Selly Oak Hospital in Birmingham, like so many other hospitals in Europe, has been looking at ways to help tackle the serious problem of fighting superbugs such as MRSA and Clostridium difficile. In March 2007, a clinical trial was launched to test a promising weapon in the fight against infections, copper. Trial leader Professor Tom Elliott explains further.
We've been looking at implementing items on a medical ward which are made of copper. And the idea is that we've shown in the laboratory with colleagues at both Aston and Southampton universities, whereby we've shown that copper has an antimicrobial activity. And what we wanted to do was to see whether or not by putting items made of copper in the clinical environment, it actually also reduced down the numbers of organisms associated with those devices.
On a busy general medical ward, the surfaces identified as frequently touched, door push plates and handles, taps, toilet seats, grab rails and bedside trolleys, items which are normally made from stainless steel, aluminium or plastic, have been replaced by copper. These surfaces are being touched by hundreds of hands all day long, potentially passing on infection. At the end of 2008, the first trial results were announced at an international conference.
We've reported the results at ICAC, which is one of the premier meetings worldwide, and we have found that 90 to 95% of the numbers of organisms on our standard items have been reduced in terms of total numbers on the copper. So we've seen a significant reduction in the total numbers of organisms on the copper items, which is very exciting. What does this mean for the patient? It means that the risk of picking up an infection is reduced. That's what it must mean, because we know that is one of the vehicles by which organisms can spread from one person to another via the surface. So the results are very exciting. They are more exciting than I thought we would achieve. I have to say from the laboratory results, they look very promising. But when you put it into the clinical environment, you always wonder whether or not it is going to work. The findings of a 90 to 95% killing of those organisms, even after a busy day on a medical ward with items being touched by numerous people, is remarkable. So it may well offer us another mechanism of trying to defeat the spread of infection. I've been a consultant microbiologist for several decades and have got some experience in terms of fighting infections. Prevention of infections has really been my goal in my career. And this is the first time I've ever seen anything as much as copper in terms of the effect it would have on the environment. We've talked about agents in the past, cleaning agents like chlorine, cleaning agents like hydrogen peroxide, which have an effect, an immediate effect, but not a long-lasting effect, like the copper. And we have shown that the copper in our study has an effect for months, from our pilot study to the study which we have presented in North America. The copper has continued to work. So from my viewpoint, from my experience, from my career in terms of preventing infection, this is a very exciting finding, an unexpected finding that perhaps copper will give us its advantage in keeping surfaces clean and enabling us to perhaps challenge infections further. It's an intelligent metal. The copper is quietly working there in the background, killing the organisms all the time. It needs to be part of what we call a bundle of care in terms of an approach to prevention of infection. And in our trust, led by our senior nurse, we've got what I would consider to be some of the highest quality infection control preventative measures in terms of washing of hands, cleaning of surfaces, managing the environment. This gives us another arm, it gives us another weapon to fight the infections which are around us and challenge us all the time. So I would see this as an addition to the bundle of care we have at the moment.